We know there's been this larger movement to increase healthcare access, to improve quality. But underneath that movement has been a group of folks who have committed to really pushing the boundaries, making sure that we widen the safety net, stretch the umbrella a bit to include as many individuals as we surely can. A lot of people, when they hear me say, when they hear that I've written this book called 150 Years of Obamacare, they go immediately to, oh, 150 years? But that's not the case. We have been trying to push a health equity agenda for over 225 years. And no matter how hard these health equity champions tried to reinsert that language, to get it over the passage, to get it passed, they just couldn't succeed. And so, thankfully, President Abraham Lincoln's folks, although he died, he was assassinated a few weeks after that bill was signed into law, his folks decided, well, you know what, we believe we have the authority to establish hospitals to increase access based on the language in that bill. So even though it wasn't explicitly included, they found a way to get around it. So after that, though, here's the clicker. So we didn't get mental health reform signed into law. We get this comprehensive health reform, this what I call the first social determinants of health law signed, but that only lasted 7 years. They looked at where the gaps were. They looked at where the crisis was. What could we then develop or create to address these issues, right? And so they worked on that, they got some stuff done, but it was never codified into law. And then the Bush administration comes in and says, you know what? We've got to codify many of these ideas that generated from the Reagan administration. And so for the very first time, they came out with the Disadvantaged Minority Health Improvement Act, right? And at the same time they did that, they also came out with Healthy People 2000. Anybody familiar with the Healthy People agenda? Yes? It's our nation's public health agenda, right? Over the next 10 years, we're going to try to meet certain benchmarks. And so what they did in 2000, in the 2000 version, was to say, we're going to include the language, reduce health disparities. And then folks said, no, don't do it, Secretary Sullivan. Don't do it, President Bush. That's, again, way too contentious. But they ignored that and said, we've got to do it. It's the right thing to do. Then we made this national security argument because folks weren't listening to us anymore. And at that time, there were 600 generals and admirals who had convened and produced a report with the Department of Defense showing that 70% of young people, 17 to 24, that's 70%, were unfit for military service. They were extremely concerned at the increasing obesity rates. They were concerned with the increasing suicide rates, et cetera, among young people, the mental health issues that they had. They said, we have to do something about this. And we leveraged that report, and that's what helped us to get over that hurdle. And so we made the argument that these issues aren't isolated. They impact the social and economic vitality, because if folks are sicker and dying younger, they're not able to contribute to their communities. We now have an opportunity with the ACA, with other health equity policies, to say, listen, we don't want to repeat the same mistake that took place 150 years ago. And I wanted to leave you with this poem by Dr. Benjamin E. Mays, an illustrious educator, the former president of Morehouse College, who, in his tenure, would actually present this to many of his students. He says, I've only just a minute, only 60 seconds in it, forced upon me, can't refuse it, didn't seek it, didn't choose it, but it's up to me to use it. I must suffer if I lose it, give an account if I abuse it. Just a tiny little minute, but eternity is in it. How true is that for individuals with behavioral health challenges today, right? Who have been struggling for generations to get equity in behavioral health. As one of our former presidents reminded us. He says, our destiny is not written for us, it's written by us. And I look forward to writing that next chapter with you all to increase health equity, not only here in the state of Colorado, but beyond nationally. Thank you all so much for the work that you're doing.